test, just with a prick on your thumb, possibly. She can do a quick diagnostic test for you this morning. So yeah, we've got that happening today. I think she's round the side, but I'll check. Scholar, come and show your face. Yeah, yeah, and then we have so then Dr. Tolani is all set up there, our pelvic floor nurse. We have a food bank at the charity, so we'll set up our table. You see like what we give out in the food bank and stuff. And what else are we missing? Registration desk is up there, of course. Okay, so let's go grab some breakfast. So please, we have 10 minutes. Please, 10 minutes. You can bring your breakfast back here. Feel free to bring your food back here. And then, so once it's 12:05, we can get started. All right, see y'all in a bit. Thank you. How do we turn this off? Good morning, how are you? Yeah. No problem at all. Okay, no worries, yeah. All right, go grab some breakfast. How do we turn this off? How do we turn it off? Okay. Press. I need to go to my nose. Keisha, you don't eat breakfast because
Hello? Hello? just don't know why.
community awareness event at Cancer Care Diaspora. So I'm yours truly, Laura Urobo, as always, and it's always good to see everyone, all the beautiful and handsome faces. Thank you for coming today. I know it's Christmas in a few days, and you also took our time to come and join us. So thank you. You're all welcome. And I'm sorry about the delay. Just some things beyond our control. Sorry, but I'm glad you're all patient with us. We're going to get started now. This is the drama theatre we'll be using for our main event. We have 3 speakers lined up today, and if you just go around the side through this door, you see the canteen, through the courtyard to the canteen, and then in the canteen we also have. Sorry, I feel like I'm losing my voice here. At the canteen, the toilet is just round to the left of the canteen. Once you go into the canteen, round the left is where we have the toilets. And hopefully there'll be no fire, alarms, because we're not doing fire drill. So if there's any alarm, probably just have to all come out and go in the courtyard. But fingers crossed, we'll be fine for today. Food is ready in the canteen for lunch, and I hope you've all had breakfast. We have some pastries and meat pies and pop-up and all in the canteen for breakfast. You can always nip down there and get a snack if you want, drinks and all up there. We have Can, they're doing a health check. Maybe they want to have a quick health check, but we're going to start now. I know some ladies have been there, so if you want to have any health check done, that'll be after the second speaker. We have a little break then. So yeah, you can always go to Score Live just round the side, round here. That's my right here. Okay, and then we have some displays around here. We have a food bank at the charity. We brought a few things that we usually give out from our food bank, but we give out some more. We give out cultural food, trust me. We give out rice, yams, plantains and stuff. We'll just brought a little thing to show what we do in the charity. And yes, so I have my lovely volunteers all around. We'll get to meet everybody later, helping to set this up today. And I'm going to introduce our speakers without wasting any more time. I have 2 wonderful speakers present, and the last speaker is running late, but he'll join us, definitely. He'll join us shortly. So I'm going to bring to the, is it the podium now? What do we call this? I'm going to bring out to the front our first speaker, Tolani Balogun Akinjide. She's a pelvic floor specialist nurse at Manchester Royal Infirmary, and she's going to be speaking to us about pelvic floor problems, a silent epidemic. So when she comes, she's going to give all of us. So let's welcome Tolani to the table. Thank you. And then our second speaker for today is Dr. Eddie Osage. He's consultant gynecologist at Alexandra Hospital in Cheadle, Manchester. So we're going to bring, he's been, I've known him for years and years, and he's a specialist when it comes to women's health, and he's got a passion for it as well. IVF, fertility treatment. If you have anyone that has any of those issues, Dr. Eddie Osage is the right person to run to. We'll get to find out more about him while he's doing his talk, and of course, at the end, when we're doing our networking questions and answers. So let's bring to the table Dr. Eddie Osage. So our third speaker, when he comes, we will introduce him and then he will join us on the table. So without wasting much time, we're going to get on straight on it with Tolani.
Thank you very much, Laura. Good morning, everyone. Oh no, that's not for me, trust me. Good morning, everyone. You all look radiant. Can you give yourself a round of applause? Thank you. Hello. Can you give yourself a round of applause again? Thank you. Thank you. Thank you for that. So my name is Tolani Balogun Akinjide. I'm a pelvic floor specialist lead practitioner at Manchester Infirmary Hospital. And I'm also the senior consultant at EPI Consulting. And what we deal with is women's health generally. Well, I'm specialized in the pelvic floor section. And I'm quite privileged to be here this morning. Laura, I would like to say thank you. I've known you for years. Can you give her a round of applause for me? I remember being here a couple of years back with Dr. Hedy as well. Then I was teaching on cervical cancer. So it's really good to be back today, 2024, 5 years after. So like I said, before, without wasting time, we're going to speak on pelvic floor dysfunction, which does affect quite a number of people. So thank you very much. So who is coordinating the slide? I want my slide now. Thank you. So basically that's it about me. If you can just have a quick look there, and you can just take me off. Don't worry. We'll get back to me later, because I'm here already. Right. So before we start, I want us to do a quick exercise. Can you all get your phone out, please? And go to Kahoot Play. And I want everybody to be involved. Kahoot Play. And then you can either scan or you can use the number there. Because we need to know what we know so that it will help us with the section reading. So Kahoot Play. When you guys are ready, just say, I'm ready. Ready. Thank you. One person, ready. So the pin is there, you can use the pin. Anybody else? Ready? No? Okay. Ready? I've got the second ready. Use any name. It doesn't have to be your name. You can have something like strawberry, cakes, pumpkin, anything you like. So that you don't know your scores. But the truth is, today, anybody that won, they're going to get a gift from me. Yes. There's going to be a gift today. Oh, I'm loving these. Genius. Helen. Hot cake. I love that. I love hot cake. I like anything hot. Hanji, Hannah, Salma. Ooh. Omolayo. Tejiri. Lady Love. Right. When we're all ready, please let me know.
Ready.
Are we all ready?
Yes.
Are we sure? Somebody said no. Who say no? Okay, I'll give you 1 second more. Quick. Are we ready? Okay. So can we start now, please? You have to be quick because it's about 10 seconds, 20 seconds, 30 seconds. So let's see the winner for today. Yeah. So we can't see the question. Start. Yeah, we want you to start now. Start, everybody. Mm-hmm. What percentage of women experience pelvic floor dysfunction at some point? 10 to 15, 60 to 80, 40 to 65, 25 to 30. 18 seconds, 17, 16, I'm scaring you now, 30, 12, 2 and 1. Okay. Next. Aha. Who's Tega? Aha. Next, please. Which of the following is a common symptoms of pelvic floor dysfunction in both men and women? Thank you. Yeah, this is better. Can you see it? Do you want to come forward? So you have swollen lips, chronic pelvic pain, hair loss, all of the above. This is going to be really, really interesting. Next. Someone is taking over. Getting interesting. So this is a true or false question. Pelvic floor exercise are only beneficial for women. True or false? Laura, I'm going to arrest you. Don't do that. True or false? Oh, you take care. Okay. Right, the next question. What is the most common pelvic floor dysfunction amongst men? Erectile dysfunction, pelvic floor dysplasia, urinary frequency, bowel incontinence. That's very tricky. 9 seconds. 5 seconds. Going. Let's see. Oh, who is new taker? Interesting. Okay, that's a true or false question again. Prostate cancer can lead to pelvic floor dysfunction in men. True or false? It's a tricky question, trust me. Aha. Who is new taker? Who is new taker? Who? Oh, that person is anonymous. Okay. Which of the following contributes to pelvic floor dysfunction? Obesity, pregnancy and childbirth, chronic constipation, all of the above. No chorus answer, please. 7 seconds. Next, please. That's a true or false answer question again. Pelvic floor exercises are only recommended after childbirth. True or false? No chorus answer. If I see you, I'm going to charge you. True or false? Okay. Who is new taker? I'm sure the person will reveal themselves later. Because there's a prize. Right. Which of the following is the most common myth about pelvic health? Only women experience pelvic floor issues. Pelvic health concerns are a normal part of aging. Pelvic floor exercise are for older adults only. Pelvic floor exercise are only for women. There's actually 2 true answers there, because there's a repeated one there. Yeah. Okay. Next, please. Men are likely less to experience pelvic health issues such as urinary incontinence. Less likely. True or false? No chorus answer. I will charge somebody today. And last but not the least. Okay. That should be simple. Which, if the following should be not a common symptoms of pelvic floor dysfunction? Difficulty controlling your bowel movements, urinary incontinence, chronic pelvic pain, increased appetite. And who is the winner? So can you give a round of applause to Johnny's? Third Hall. Who is Johnny's? Ginny's? Oh, why are you shy? Oh, well done. A round round of applause for her, please. Thank you. And AK. Woo! Well done, well done, well done. And who is new taker? Aha! Well done, well done, well done. Please, after the section, I need to give you one of my book. Yeah. So let's go to the slide now. So I think everybody is ready for today. We're going to make it very quick. Right. So before we go into the section, I just want to go quickly, to speak about a few data and some of the myths and facts. The recent findings, which is like last year, this is RCOG, it means Royal College of Obstetrics, Gynecology. I'm sure Dr. Hedy, those are the guys there, So one, the new data that, in terms of the UK, we're talking about 60% of women having at least one pelvic floor dysfunction, usually, at least. Even though people don't talk about it. Then nearly 1 in 4 women have never done any pelvic floor Kegel exercise before. They've not even heard about it at all. Okay? Which is a fact. Pelvic floor dysfunction is affecting millions of people in the UK. That's a fact. So now, let's go to this survey. They managed to conduct a survey of 2,000 women, not men, 2,000 women in the UK. And one of the results that revealed was 21% of those women has urinary incontinence. If I ask the audience, how many of those women do you think we fell into between age 18 and 25? What will you say? Anybody? Between age 18 and 25. How many percentage do you think will suffer from pelvic floor dysfunction? Sorry? 20%? Okay.
70%.
70%? No, that's too high. 5%? That's too low. 15 is too low. So it's between 25 and 30%. So these are the things that we don't really talk about because we just assume that pelvic floor dysfunction is an older people's problem. But the answer today is no. It does affect a lot of people, any age categories, okay? So out of those, 25 experience a frequent urge to pee. Ladies, a lot of ladies that have 1, 2, 3 kids, whether vaginally birth, cesarean birth, it doesn't really matter. There's a high chance that at some point your pelvic floor muscle can break. Okay? Then going to that, we say 55% do not currently do any pelvic floor exercise at all. So if you're here on this auditorium, whether you're a man or a woman, how many people do their pelvic floor exercise daily? Anybody? Okay. Is it daily?
No.
How often?
Twice a week.
Twice a week. I like that. I like that you're very truthful. And the truth with pelvic floor, especially if you have laxity or weakness to the pelvic floor, the way you can tone it up is by regularly being consistent. So that will really, really help. Okay. Next slide, please. Let's go to the next slide. Let's leave the survey. I think I will talk about it more because we don't really have much time. Right, this is a screening tool. I'm just going to read it out. You don't have to say anything. You can write it down yourself and just, to help you if you have any problem with your pelvic. So pelvic pain in the genital, if you are here today and you have pelvic pain in the genital, in your perineum area, so I'm going to show you what I mean. Let's do this. Do we know where the perineum is? Anybody? Women? Men? Do you know the parts of your pelvic area that you have your perineum? Anybody? Okay, we're coming to that again. Right. So your perineum is between where your vulva and your vagina area is and the bowel. So it's that tiny space there. Okay? That tiny space there. Right. So if you have any pain around that area, your pubic, which is there, your bladder, or pain during urination, there's a possibility of a pelvic floor dysfunction. Okay? If you've had a fall in the past and you fell on your back or your tailbone, then you need to be careful, especially if you feel like you're having pain since then. If you sometimes experience one of the following: accidents, loss of urine, if you sneeze, cough, jump, run, and you have a tiny leak, there's a possibility that your pelvic floor is weak. Okay? If you have frequency as well to urine or to open your bowel, which means if you need to pee now, you can't wait, you have to go almost immediately, there's a high chance that something is wrong somewhere. Okay? Don't tell me, just know. So that will help you to present and go to your GP or your health practitioner, because a lot of people are not speaking out, a lot of people are not presenting, and the figure that is jumping to us is 1 in 4. So you can imagine if people are actually presenting, there's a high chance or possibility that the number is way higher. Okay? If you have any pain sensation during urination, which we've talked about before, speak to somebody. If you have to wake up at night more than 2 times to pass urine, speak to somebody. Then if you have a feeling of pelvic floor pressure, or when you sit down you feel like there's something like a heavy weight, you might need to speak to somebody as well. So that's just giving you some tips. There's more, but that's just a few tips. So can we have the next slide, please? Thank you. Aha. History of back pain. How many people here? History of back pain that's lasted more than 6 months? Back pain. Okay. Hip, growing pain, sciatica pain. Some people will fall into this category. When you go to the toilet, you need to defecate or you need to pee. And you pee and you feel like there's still something, but it's quite difficult. Go and speak to somebody, please. Okay? Pain during sexual intercourse, that's something that nobody talks about most often. That could be, one of the pelvic floor dysfunction issues. So please do speak to somebody. Back pain, we've mentioned that. Bowel issue, we've mentioned that. And yeah, that's it. Can we have the next slide, please? So, what does your pelvic floor do? Anybody? What does your pelvic floor do? When people say pelvic floor, what do you understand? Anybody? It doesn't have to be right or wrong. You're scaring me. Everybody's looking at me like, oh no! When you hear the word pelvic floor or pelvic floor dysfunction, what does it mean? What does it mean to you? What's your understanding? Just say anything. Guys, do you want me to start speaking? Because I could do. I can use the power of being here now. I'll say, nobody. Okay, let's have the next slide. Right. So pelvic floor dysfunction simply means when there's a discoordination or issue with coordination within your pelvis, okay? Which can then affect the activities of the pelvic floor. Sometimes the pelvic floor is worn out. Most people that are tensed, stressed, and that have anxiety, they might have pelvic floor problem just because of that. Okay? So if you have problem urinating, opening your bowel, or pain during sexual intercourse, you might have some kind of pelvic floor dysfunction. Can we have the next slide? Okay. I want every woman here. Every single woman here. Can somebody volunteer to label this? Anybody? Put your phone down and put it. Don't just put it down. Can anybody label this? What can you see, ladies?
The ovaries.
Who said the ovaries? Mommy, where's the ovaries? Thank you, ma. Can you give mommy a round of applause? Thank you. So, ladies, what else can you see? Women, I'm expecting everybody to know one thing. Because if you don't understand, if you can't label, and if you don't know, then how are you supposed to present yourself properly? Especially when you go to the doctor and say, oh, I think. Because sometimes when you have a bit of knowledge around this things, it does help us with assessment. Uterus. So where's the uterus? No, don't just point. Just tell me where exactly you think. Where? In the middle bit. Number 3. Okay. Oh, it's still mommy that is saying it. Huh? Which lady? Oh, give her a round of applause for me. Thank you. Anybody else?
Very obvious.
Anus, very obvious. Okay. Think.
Vagina.
Okay.
Vagina.
Vagina. Where's the vagina?
Vagina. The last bit.
Mommy, I don't want you to answer again. Where's the vagina, ladies?
Tiny one.
The tiny one. Where's the tiny one? I won't allow you guys to just be tricking me because you're talking about organs now. Where's the tiny one?
The one with harrow.
Okay, the one with arrow. When I go there, just come here.
Yes.
And do we all know that the vagina is actually an internal organ? Because I teach that separately. You can't see your vagina. Because most lady thinks their vulva is their vagina. So I want to drop that today. Okay? It's an internal organ. Thank you for saying that. Give her a round of applause. So what else? There are a few things.
Urethra.
Urethra. Okay. Thank you. Okay, let's go. So nobody can spot the bladder. And you pee all the time. Men, women. Under the uterus, mommy, thank you. But mommy, I don't want you to say anything now. You've given them too many originals. Okay, so let's get to the next slide. Thank you, everybody. Give yourself a round of applause. Voila! So how many did you know before? I want you to study it today. And I have my reasons. It is very key, very important to understand our anatomy. Very, very important. So you can see the urethra there. You can see the vagina. Okay? Thank you. So can we have the next one? Next exercise. Aha! Men, both the media men, don't even think you are excluded. Men, how many can you label? And women as well. How many? What can you see?
Sacrum.
The sacrum. Mommy, don't talk again. Thank you, Mama. Okay, that one is very obvious. What else?
Testicle.
Mommy, don't say anything again. No, Mommy, don't say anything again. Anybody else, men in the house? Backbone? Anus? Okay, let's go to the next slide. Let's do a review. Voila. If I asked men in the house to tell me where their prostate is before this picture, will you know? Because when I do anything around prostate cancer, a lot of men, and I'm talking about 99% aside practitioners, they think their testicle, their urethra, is actually their prostate. So we need to be conscious and intentional to learn all these things because it's going to help with presentation. It is very important. Can we have the next slide, please? Okay. Go back quickly. Yeah. So what do you think pelvic floor does? Functions of the pelvic floor. Anybody? At least you've seen so many organs, so I'm expecting a lot of answers now. If you have an answer for me, just raise your hand. Pelvic floor, functions? I will give you, mommy.
Support the organs.
No, nobody should check their phone. Nobody.
Yeah, it supports the internal organs in the lower parts of the body.
So, mommy said the pelvic floor supports the organs within the lower parts of the body. Anybody else? Can we have the second mic, please? Can we have the second mic? And please, no go-go. If I find you, I will arrest you. I'm an officer, in case you don't know. Anybody else? We need to talk about this thing. There's no right or wrong answer. I like it when people try. What else? Function. How many women here has had a baby before? Okay. 1, 2, 3. How many? Aha. So, how did your baby drop? What did you do? So it opens. Okay, so what do you think was happening with the opening and all that? So we need to study more, please. Okay? We do. Right, can we have the next slide now? I just like poking because, we can be attentive. I'm not, there's no right or wrong answer. Just say whatever comes to your mind. And that's how we learn. So your pelvic floor function, like mommy said, number 1, is going to support pelvic organs. And those are the organs that we've seen before. We're talking about the uterus, right? We're talking about the bladder, the bowel, and so many other organs. Controls bladder and bowel. So you need your pelvic floor muscle to coordinate and control. If there's a problem, that's where you see that people are having urinary incontinence, bowel incontinence. And these things are so common that you can think or imagine. It's just that nobody talks about that. It is very, very common. Your next person to you might actually be suffering from them. But people do suffer in silence. Because we've named it like a taboo thing that we don't discuss. It's very easy for me now to say to Laura, oh, Laura, I'm having a chest pain or I'm having a headache. But it might be very difficult for me to say, Laura, actually, I have pain during intercourse. Or sometimes I have smearing or I have incontinence. And I think we need to break the taboo because you need to start thinking about it as part of the organ. So if you can talk about your heart, you need to be able to talk about your pelvic floor, okay? So passing of urine, breathing. Do we know how that affects our breathing? Where are my gym fanatics? Does anybody go to the gym here? Anybody? Gym? 1, 2, 3, okay. Major. Good. So do we know where our core muscles? Core muscles. Have you heard about core muscle? You've heard about core muscle? Okay. Yeah? Okay. But that's not the only one. So yeah, that's a core muscle. When we breathe in and out, your diaphragm goes up and down. That's your core muscle in place. Then you have another core muscle there that helps you. And within your pelvic floor, there's a core muscle. Okay? And this thing, they interrelate sometimes. So you can use it to your benefit when you have symptoms. And this is why you need to speak to somebody that knows about pelvic floor issues. Okay? So let's go to the next slide. Right. Pelvic floor dysfunction can interfere with a woman's reproductive system. Do we know that? Yeah? Okay. Good. So it can affect the uterus. We've seen the organ before. Your vagina. So women who get pelvic floor dysfunction may also have other symptoms like pain during sexual intercourse. So not all pains are due to injury. Not all pains are due to infection. And the reason why I'm saying this is because especially in the continent or countries that they have what we call, what will I say now? You know, I come from Nigeria, for example. If you go to Nigeria, if you're sick, you can just walk into the pharmacy, and all you do is you tell them, I need this, I need that, I need that. Nobody's checking, you don't need any prescription. We need to be careful. And the reason why I'm saying that is I've seen quite a lot of numbers of people that we've lost due to these mistakes. I've seen people with cervical cancer or ovarian cancer that they will be recommended some kind of medication because their friend or colleague or family has the similar symptoms, which could be STI, which could be UTI, which is urinary tract infection, okay, or sexually transmitted infection. But they have cancer and they don't know, and they keep going and taking antibiotics. Of course, the symptoms, because of the medication that you're taking, can subdue your symptoms a little bit, right? But what will now happen? What do we think will happen? Delayed, right? And every single cancer can be treated, actually, if it's caught early. So it's delayed. So from stage 1 to 2 to 3 and then to 4. Then before you know it, they said palliative. They should take them home to die. Why? So we need to be careful. We really need to be careful. So can we have the next slide? Have we heard about pelvic organ prolapsing before? Anybody? Somebody say yes. Mommy. Which of the prolapse, ma'am? Uterus, okay. Anybody else? Anybody else? Okay. So I'm going to drop something now. Most of women that has had babies, I'm not saying all, I'm saying most, okay? Or that are older, a lot of people from that category tends to have pelvic floor organ prolapsing. It could be a rectal seal, which means the frontal part of the uterus, right, is sagging out, okay? It could be a rectal wall prolapse, which is the lining of the uterus, okay? It could be cystosis, it could be their bladder. But a lot of people don't have symptoms. And this is why we need to speak out. This is why we need to understand some anatomical part of our body. So that if there's any changes, you can pick it up easily. How many people here, let's say for example women, does have a look at their private part? How many people? Do you check? Okay, if you don't, I want you to start from today. So that if there's any changes, you can pick it up easily. How many people are comfortable to discuss with their partner and said, oh, I'm having this issue? Or how many men are actually comfortable to discuss this issue with their wives as well? I'm going to tell you a quick story. And this is somebody that I really know. This guy is suffering from pelvic floor dysfunction, which is causing now erectile dysfunction. Rather than this guy to speak to the wife and say, you know what, I'm having this problem. The guy stopped having whatever with the wife, okay? The guy would rather go to work and come back as late as he can, tired. And that's an intentional thing. He was doing it for, I'm not talking about months, I'm talking about years. What do you think is going to happen to that relationship? Anybody? Pardon? Break. Strained. Yes. Strained and break. Such women, what do you think will be going through their mind? He's cheating. Thank you. Yeah? Yes, he's having an affair. But this particular guy, there's no affairs, there's no cheating. He's just running away because it's a very shameful thing. So you can imagine if he can't speak with his own wife about this, how much more anybody else? And that's why we are having very limited people presenting about issue like this. So if you have anything at all, please go to your GP, go to your doctors, speak to somebody that can help you. Okay? Thank you. Can we have the next slide, please? No, can we have the one that you took? The previous one. Thank you. Okay, symptoms of pelvic floor dysfunction. These are just some of the symptoms. Okay? Lower back pain, we've talked about that before. Hip pain, incomplete bladder empty. If you go to the toilet to pee, and 45 minutes later, you're going back to the toilet to pee, and an hour later, you're going back, there's a possibility there's a problem. Okay? You should be having at least good 2 to 3 hours interval. Do we know that? Yeah, we should. Okay? Constipation. Where I come from, when you have constipation, they will ask you, go and buy 100 liver salt. In fact, these days now, the internet is causing a lot of eruption. A lot of kind of, everybody is an expert. You get different mixtures. Although some of these mixtures will cause you to purge, but that's not taking anything away. So if you're here today, if you suffer from constipation that has lasted more than 6 months, which we now term as chronic constipation, please go and speak with somebody. A lot of people are being placed on laxatives, but we need to get to the root cause of the constipation, because it can be more. It can be defecatory issue. It can be that you have what we call slow transiting. Okay, so please speak to somebody before your organs start prolapsing, before you start straining. There's a lot of things that we do that contributes to the problem that we have. But we have an idea or the knowledge that we can stay away from such things. Okay? Thank you. Can we have the next slide now? Right. If the pelvic floor muscles are too tight from overstraining or stress and anxiety, you may experience one of the following. Lower back pain again. Can you see? So when it comes to pelvic floor dysfunction, and I'm sure Dr. Eddie is going to be talking about sexual health, and I don't know what his topic today is, and some of the symptoms are going to be similar. And this is why you cannot just go on Google and say, oh, I'm having this back pain, and I'm having this, and I'm having this. You know what Google will actually do? I love Google sometimes. It will scare you. It will give you the worst of the worst and say this is the problem. But sometimes it could be UTI, sometimes it could be cancer, like I said before. Sometimes it's endometriosis, sometimes it's fibroid. But their symptoms, personal symptoms or physical symptoms, might mimic each other. So we need to be careful. Let's speak to people that knows. Don't rely on Google. Don't rely on what the internet say or what people are advising. If they are not specialists, they are not specialists. Okay? Sexual dysfunction. Shifting bulging. Okay? Incontinence. So these are the things that could happen. Can we have the next slide? So type of pelvic floor dysfunction, we've put few there. We've talked about almost everything there. Sexual dysfunction, we've talked about that. Chronic pelvic pain, organ prolapses, urinary incontinence, and fecal incontinence. Okay? Next slide. Next slide, we've talked about that. I don't want to dwell too much on that. Okay, let me quickly go through this. So these are kind of organ prolapses. So this slide is showing us how every single organ within your pelvic floor can actually prolapse. And when something prolapses, you can imagine, look at this. Can you see the inside of this frame? Yeah? You have the uterus there, you have a couple of different organs there. So if one is prolapsing, there's a high tendency that they will have an impact. So for example, if a lady suffers from rectocele that is bulging, sometimes they feel like, they can see the bulge coming from the vulva. Some people will feel it. Okay? Some people, when they sit down, it's difficulty. They feel heaviness and all that. And this rectocele can actually have a direct impact on the bladder as well. Because when it's full and it's retaining some fecal content, the bladder feels heavy to the brain. Because the brain is not expecting any rectocele to happen. The brain will start telling you, you need to go and pee. So 1 minute you're in the bedroom, you're peeing. Then you realize, oh, actually it's not much. Then 45 minutes again, you're going back. So that is how this organ can actually affect each other. Okay? So please, let's present. So you can have the vagina sleeping, the uterus, okay? What other name can you call the uterus? I just want to be cheeky.
What other name? Pardon? Mommy, I said don't say anything again. Ladies is the womb. Okay? Is the womb. Right. Did I miss anything? Yeah, the bladder can prolapse. The smaller intestine can prolapse. When that happens, we call it enterocele. Okay? So every single organ can actually prolapse within that area. And that's why we need to be careful. Okay? And please do present. Can we have the next slide? I hope I'm doing okay with the time. 5 minutes more. Okay, so these are some of the treatments. I'm not going to go through that. There are surgical treatments. There are tablets that you can have. There are so many investigations, that we can have as well. So can we have next slide, please? Pelvic floor exercise. There's a myth, pelvic exercise is good, but it's not for everybody. Because sometimes a patient will come thinking they need pelvic floor exercise, but they are too tight. Some patients will have what we call anismus. Patient that has anxiety, for example, okay? Very anxious, tensed, or when something happens. I want you to notice when something happens bad, let's say it's something bad, or you have a lot of task, overload. At that particular period, just watch your bowel and bladder. You will realize there will be changes, okay? There will be subtle changes. So I can give you, if anybody wants, that's my guide to pelvic floor exercise. I have one for men and women. I can give you a link to download it. It's free, okay, for coming. So that's okay. Can we have the next slide? Right. So we're getting to the end, yes. So we all need to make a difference. We all need to make a difference. Healthy living is all our responsibility. You don't have to be an expert. What you've done today by coming, that's a difference. Because majority of people are actually home now sleeping and not doing anything. But if this was a party, this place is going to be filled up. Okay? So give yourself a round of applause even for being here today. So I would say raising awareness around pelvic floor, promoting knowledge and education, providing support and assistance to those who are in need. So what you've learned today, you can pass it through to somebody else, okay? And let us reach, inspire, and support everyone. And thank you for supporting Laura today by coming. So can we see the next slide? Now, can everybody stand up? We're done. Can everybody stand up? I want you to raise up your hands. And I want us to go through that pledge. And I want you to mean it. Because this is December. We're entering 2025. So, do you want me to say it first, then you repeat after me, okay? Okay. Yes. So we're going to start by I pledge to, then you go to number 1. 1, 2, 3, go. I pledge to nurture my body, eat balanced meals, exercise regularly, and prioritize rest. Number 2, I pledge to cultivate my mind, engage in continuous learning, practice mindfulness, and embrace challenges. Number 3, I pledge to honor my spirit, practice self-compassion, seek balance, and engage in joyful activities. 4, I pledge to lead by example, demonstrate integrity, inspire others, and advocate for healthy living. 5, I pledge to empower my community, share knowledge, serve as a role model, and encourage others. By adhering to this principle, I honor my role as a woman or man of substance, values, and leadership, committed to a life that is healthy and inspiring. Clap yourself, everybody. So thank you, everybody, and God bless.
Wow, thank you so much. What a way to end this party. Don't go away. This will be a road. We'll keep you here today. Let's give a big round of applause to Talani for that amazing lecture. And
honestly, I learned so many things as well. Like every day, every time we bring our speakers, I kind of like, I know it all, but you never can know it all. We learn every day, don't we? That was amazing. Thank you so much, Tolani. It's always a pleasure having you. We need to bring you for a whole day. We need two ladies to bring that for a whole day session, yeah. Because I know she's got so many things more to say to us, yeah. So thank you, even the men. I'm glad the men actually got a bit from our session today. Okay, we're going to bring our second speaker. And I just need to introduce our third speaker. He sneaked in our way, in the midst of the question, and then he apologized, don't worry. Dr. Omotala Omotosho. So he's a GP at Otunyan Village Surgery, and he's also a GP trainer. So he trains new doctors that want to become GP as well. He's because at our last family event, doesn't he? And I'm sure we enjoyed it last time. We're going to have another time to see you. Is everybody Dr. Omotala Omotosho? So I'm going to now bring our second speaker, who is a gynecologist, consultant gynecologist in Alexandra Hospital in Manchester, and Dr. Edmond Eddie Osagi. Please welcome him to the mic.
Thank you so much, Laura. Thank you for the kind invitation, and I must congratulate you for doing all of these sessions. As you said, Tolani and I were here, was it 2019? Yes. Amazing, 5 years ago. Again, I must thank all of you for coming to support Laura and for being part of these sessions. It's really important that we do these things, okay? Because knowledge is the key to healthy living. And if you have knowledge of how your body should function, when it stops functioning the way it should function, you're able to pick it up early. And for most things we talk about, the quicker we find them out, the easier they are to treat, the better the outcomes, the less the risk of the treatment. So I encourage you to just keep increasing knowledge. And as you come today, what you pick up from here, go share with other people, make sure we're spreading this knowledge, especially amongst our community, because the amount of ignorance that we face as part of this community is incredible, and it shouldn't be like that. So congratulations for being here, and I really hope that you gain a lot from this session. Laura has asked me to talk about what we call estrogen-dependent conditions. So the first thing I'm going to ask is, how many of us know what estrogen is? It's a hormone. Let me give you a little bit of a hint. It's a hormone in the body, but how many of us actually know what estrogen does in the body? Just hands up if you do. So that's incredible. Well, I'm sure we've all heard about the wonder hormone, the elixir of life, what women pay loads of money to get after they reach a certain age. So estrogen is a female predominant hormone. Okay? So when women go through during the reproductive years, they produce predominantly estrogen. And when they become menopausal, the hormone that they stop producing is estrogen. And that's why a lot of changes take place. And that's why sometimes women go back to get estrogen prescribed to them as part of hormone replacements. And that's why it's called the elixir of life. It makes them feel youthful again, it makes them feel full. And during those reproductive years, estrogen controls a lot of bodily functions, a lot of reproductive functions, and it also can be instrumental to some particular conditions developing in women. So I've picked out 3 of those conditions for us to just talk about briefly because they're very common and their impact is very significant, especially amongst our population, and hopefully we'll be able to shed some light on these to you. So one of those conditions, let me introduce myself. I'm a gynecologist and I work predominantly privately now at the Alexandra Hospital in Chile. My specialist areas are endometriosis, advanced laparoscopic and hysteroscopic surgery, and I also have some expertise in early pregnancy conditions. And of course, fertility, so all this full scope of fertility, infertility, and assisted conception. So if we start with the condition called endometriosis, I'm sure some of us have heard about endometriosis. Who's heard about endometriosis there? So, endometriosis is quite a common condition, and it's amazing how little we know about it. Endometriosis affects 10% of women. So just think about it, walking down the street, every 10th woman you have, you pass has the potential of having endometriosis. Okay? And endometriosis can cause profound symptoms, and that's why it's really, really important to know about. Endometriosis is a condition where, if I just go back a little bit, when women have periods, what normally happens is periods are just a manifestation that the lining of the womb is shedding. So every month, every woman's womb prepares for pregnancy. And the way the womb prepares for pregnancy is that it builds up and gets ready to receive the fertilized egg. If that doesn't happen, the lining of the womb is shed and all of that blood comes out. But some of that blood doesn't come out through the vagina as it should be. Some of that blood passes through the fallopian tubes and goes back into the pelvis. So whenever a woman is on a period, a little bit of blood passes through the fallopian tubes and goes back into the pelvis. But the body's natural defense mechanism is that all of that blood gets mopped up, gets destroyed, and doesn't cause any problems. But unfortunately, in this 1 in 10 women who develop endometriosis, the immune system doesn't work as well, so they are unable to get rid of all of that blood. And so over time, the cells that are contained within that blood, they start with deposits on the pelvic walls of these women. Okay? And over time, these cells start to grow, and they start to bleed in their own right. So when the woman is having her period, those cells within the body also start to shed, or they start to bleed. And that bleeding causes pain, causes inflammation, causes all the changes that occur with endometriosis. And as I go through, I'm going to show you some pictures of endometriosis. I've got lots of pictures here, so I don't know if I can do this. So what we find with endometriosis is that it changes the whole architecture of the pelvis. So you have a normal pelvis that looks like this. And you can see that's the womb there, the fallopian tubes, the ovaries, everything looks clean and organized. And for women who have endometriosis, it becomes something like this. Everything is so disorganized. You see how red it is, it looks fiery. This is where all the inflammation, the pain comes from. It's affected the fallopian tube, there's stuff to the ovaries. So a woman like this will struggle to get pregnant. And because it's just so red and inflamed, this will cause pain during sex. So this is where a lot of the symptoms of endometriosis come from. We do not know what causes endometriosis, but we know that there is a genetic link. So women who develop endometriosis have a genetic predisposition. And that genetic predisposition seems to affect their immune system, and that is where endometriosis comes from. As I said, it affects 1 in 10 women, so that's really common. And the features of endometriosis. So the main symptom of endometriosis causes is pelvic pain. Okay? And it could be pelvic pain associated with the periods. It could be pelvic pain that is not connected to the periods. It could be pain during sex. So the message I'll give here is any woman who has severe period pain that interferes with her lifestyle, stops you being able to go to work, stops you being able to go to school, stops you being able to Functionally, that is not normal. Okay? And if you experience that, you may have endometriosis, and you need to see somebody to check that that's not the case. Any woman who has severe pain during sex, that is bad enough to stop you having sex, again, that is not normal. And if you're experiencing any of that, then you need to consider whether you have endometriosis and get that checked out. In more severe cases, endometriosis can cause pain outside of the period, and so women can have pain all the time. And it can also cause pain that is associated with passing urine, associated with moving about. So pain is even among symptoms of endometriosis. And as Tolani said, endometriosis can also impact the pelvic floor because it just causes generalized inflammation. So it can cause pelvic floor dysfunction. So it can affect urinary function. So it can make you pass urine more frequently. And it can make you pass through more frequently. It can cause loose stools, especially during periods. And some women can, especially when it invades into other tissues. So women can have blood in the urine and blood stains too. So those symptoms are quite common, and that's why it's really important to see a specialist, so you get examined to find out exactly what the source of those symptoms are. Now, we have various types of endometriosis. In the past, we used to think endometriosis was just one condition where there are lesions in the pelvis, but we now know that endometriosis is actually a generalized systemic inflammatory condition that can affect virtually any tissue in the body. But the commonest area where we find lesions are in the pelvis. The commonest type of endometriosis we find in the pelvis is the type that affects the peritoneum. The peritoneum is the lining of the pelvis. And when you have these sort of darkish inflamed lesions affecting the lining of the pelvis, that's what we call peritoneal endometriosis, and the most common type that we find. Endometriosis can also affect the ovaries. And when it affects the ovaries, it forms cysts in the ovaries. So you have these ovaries that are enlarged by big cysts. And unfortunately, those can go to quite big sizes. In some women, they can rupture and cause bigger problems. So they can affect fertility, they can lead to pain, and it's really important that cysts like these are found early. And we also have the deeply infiltrating endometriosis, where endometriosis can grow into bowel. So that endometriosis of growing into bowel can go into bladder, and it's very important to find this out. Unfortunately, we have women who have developed endometriosis affecting their bowel, have gone to bowel obstruction, and that can cause more acute and significant illness. And where endometriosis affects the ureters, it's not detected early. It can cause blockage of the ureters, damage the kidneys, and we have to remove the kidneys in some women with endometriosis. Now we have endometriosis that can also grow into the womb, okay, and that's a condition we call adenomyosis. And then endometriosis that grows outside of the pelvis, which we call extrapelvic endometriosis. For all of these types of endometriosis, it's still predominantly estrogen, the hormone that predisposes to them, and the predominant symptom is pain. But apart from pain, it can cause infertility, it can cause emotional problems, psychological problems, and generally impact significantly on women's productivity. One of the problems we encounter with endometriosis is the delay that we experience with the diagnosis of endometriosis. And this is because endometriosis is tied to women's menstrual cycle mostly. A lot of women, when they complain about painful periods, because they're told it's part of the woman's problem, they take some paracetamol or ibuprofen and get on with it. So unfortunately, we do experience a significant delay in diagnosis of endometriosis. And estimates are that women can spend about 8 to 10 years going back and forth to different doctors before the endometriosis is diagnosed. So that's the list of the symptoms we predominantly get with endometriosis: pain, as we talked about, sexual dysfunction, menstrual dysfunction, heavy periods, painful periods, prolonged periods. Women with endometriosis can experience significant fatigue, lethargy, and psychological problems that can lead to poor quality of life and infertility. The diagnosis of endometriosis is actually not too difficult. Just by speaking to women and understanding the nature of the symptoms, we can have a very good idea in about 75% of cases if a woman has this likelihood of having endometriosis. And then in addition to talking to the women, an examination and an ultrasound scan, I would say in more than 90% of cases we have a very good idea of women who have endometriosis. At which point we can now discuss treatment with them. In some cases we might need to revert to more detailed scanning, like doing MRI scans, to make the diagnosis. And the treatment of endometriosis again is quite straightforward. We talked about the red flags of endometriosis: fluid with alcohol, severe pelvic pain, abdominal bloating, menstrual pain that's disrupting life, infertility that is unexplained, painful sex, nausea, vomiting, flu-like symptoms during periods, urinary and bowel dysfunction during periods. Anybody who experiences those, think about endometriosis. The mainstay of treatment of endometriosis is surgical excision. So I'm sure you've all heard about people surgery, laparoscopic surgery. That's how we deal with endometriosis. And for most women with endometriosis, day case laparoscopic surgery affords excellent cure rates. In more than 90% of people who have good relief from their symptoms, gradually get rid of the disease, and the chance of recurrence is relatively well controlled as well. There are options for medical treatment. So anything that we talked about estrogen predisposing to endometriosis, anything that counteracts the effect of estrogen can help with treating endometriosis. So things like the combined pill, the progesterone pill, and other drugs that can cause a reduction in estrogen production, like things that cause medical menopause can help to treat endometriosis. So it really depends on what your circumstances are. It really depends on whether you want to try and get pregnant. That will determine what the best treatment is. But the message to take away is endometriosis is easy to diagnose. Endometriosis is easy to fix. And the treatment is very effective. And the sooner you get checked by your doctor to see if you have endometriosis, the easier it is to put in place a treatment plan for you. Okay, so we'll move on to the next estrogen-dependent condition now, which is uterine fibroids. Fibroids are pretty similar to endometriosis in that they depend on the function of estrogen stimulating the growth of fibroids, but they are a totally different condition. The way to think of fibroids is to consider them as benign lumps in the womb, and And again, they are very common, especially amongst the Afro-Caribbean community. I would say at least 50% of women of Afro-Caribbean origin will experience fibroids at some stage in life. And fibroids can significantly impact the quality of life of Afro-Caribbean women. The predominant symptom women with fibroids experience are menstrual dysfunction, so very heavy periods. So if you're getting very heavy periods that are interfering with your everyday function, that's not normal. So you get that checked out. Prolonged periods, pelvic pain, abdominal swelling, and fibroids can cause infertility as well. It's easy to diagnose fibroids, just as we said with endometriosis. Just from talking to women, doing an examination, with a simple ultrasound scan, we can pick out women with fibroids. And fibroids are easy to treat. There are very, very good surgical ways of removing fibroids, including keyhole surgery. So fibroids that are amenable to keyhole surgery, we can remove by keyhole surgery. Those that are a bit too advanced to remove by keyhole surgery, we can undertake open surgery to remove them. And for women who have completed the family size, who do not need the wombs anymore, we do hysterectomies to get rid of wombs that have very big fibroids. There's also some room to treat fibroids medically. In women for whom pregnancy is not an issue, and again, for those women who use medication that counteracts the effect of estrogens. So fibroids are common. Fibroids can impact women significantly, but they're very, very easy to detect and they're very easy to treat. So any woman who suffers significant menstrual dysfunction, experiencing abdominal swelling, or infertility, I would recommend that you speak to your GP and get examined and see if you have fibroids and get those treated. And I'll just talk briefly about the chance of developing cancer if you have endometriosis or fibroids. The one thing I would say is both of those conditions are benign conditions. We consider that endometriosis and fibroids are benign conditions. But there's a very, very small chance that you may fibroids that are long-lasting, especially in older women, can develop into cancer. It's a very small chance, and the risk of cancer developing in fibroids in older women is maybe about the order of 7 fibroids in 1,000 women. So it's a very, very small chance. But if fibroids develop into cancer, they will generally become more painful and they will go at a much faster rate. So the message to take away is for older women, especially for women who are past the age of menopause, if they start getting pain from fibroids, and the fibroids are growing very, very fast, then those are red flags for cancer. For endometriosis, endometriosis is generally a benign condition, but sometimes for, again, long-standing endometriosis, clearly for those affecting the ovaries, we sometimes can pick up malignant change in ovarian endometriomas. The risk of this is very, very small. It's less than 1 in 1,000, and generally that's something that can be picked up by the radiological tests that we do. Okay, I'll just round up now by talking about womb cancer. And womb cancer, also called endometrial cancer, is the 6th most common cancer in women, but it's the commonest cancer in of the reproductive organs. And womb cancer is something that can be prevented because of some of the symptoms. If those symptoms are addressed early, then womb cancer can be picked up at an early stage and dealt with easily. We can start with the things that predispose to womb cancer. We talked about estrogens. So the predominant predisposition to womb cancer is prolonged exposure to estrogen or unopposed exposure to estrogens. And the things that can put you in a position where you're getting prolonged or unexposed exposure to estrogen are things like obesity. Okay, so that's something that we can all do something about. I don't know if anybody's heard about the condition called polycystic ovary syndrome. Anybody? Yeah? So polycystic ovary syndrome is a condition that affects women during the reproductive years, where for some reason women stop ovulating regularly, and because they're not ovulating regularly, they could just keep producing estrogens and they do not produce any progesterone to counteract the effect of those estrogens. And over a long period of time, those women have an increased risk of developing womb cancer because estrogen just keeps getting the womb without any progesterone growth. And women who use HRT over a long period of time, because of again of the prolonged exposure to estrogens, are at increased risk of developing womb cancer. Similarly, women who have late menopause, so if you have maybe you start having periods early, and if you're having menopause later than usual, then you have a more prolonged exposure to estrogen than you have in women, and that puts you at risk of womb cancer. Some people have genetic risk of womb cancer, there is a family history, and for people who have a condition called Lynch syndrome that can run in families, always are genetically predisposed. And women who have diabetes also have an increased risk of womb cancer. So as I said, womb cancer is quite common, account for 50% of all genital cancers. And generally worldwide, we are seeing an increase in cases of womb cancer, and that's been related to increased incidence of obesity all over the world, increased use of HRT, so women are more exposed to estrogens. And I just noticed that black women are twice as likely to die from having womb cancer than Caucasian women. And that's, again, speaks to a lot of the health inequalities that we talk about and why we should be aware of these conditions. So what to look out for? Bleeding after the menopause. So any woman who has stopped having periods and experiences vaginal bleeding after your periods have stopped, that's not normal, and you should always get that checked out. For the vast majority of people who experience that, it won't be cancer, it will be just maybe menopausal changes within the genital tract, or a polyp or something, but you don't know until you get it checked out. And that's quite a common symptom for womb cancer. Bleeding in between periods or after sex, periods that are heavier than normal, passing blood in urine, and of course, extreme weight loss, anything abnormal vaginal discharge. All these are the symptoms of womb cancer to look out for. And just as in other cancers, The diagnosis of bone cancer depends on examination, scanning, and a procedure called hysteroscopy, or we can put a camera into the wound from the outside. And all of this can be done as outpatient procedures. So again, it's very easy to diagnose this wound cancer. And it involves cancers at different stages, from very early stages all the way to the more complex ones. And the earlier the presentation is, the better the chance of cure with lung cancer. Okay, and just to encourage us that treatment of bone cancer can be quite effective, and there are quite high survival rates of bone cancer treatment. So we see that there's quite a good chance of surviving bone cancer, but a really important thing is to prevent early. Okay, so I've just gone through endometriosis, fibroids, and bone cancer. And just to highlight the point that with all of these things, the important thing is to be knowledgeable about these conditions, know how your body functions, so that if anything goes wrong, if anything stops functioning the way it should, you can seek help early. And the earlier you seek help, the earlier we diagnose this condition, the better the treatment outcomes. So I'll stop there for now, and hopefully we'll have some further discussions.
So much, Dr. Eddie. Wow, that was an amazing one as well. How many of you have been loaded with information today? Good information, yeah? We're going to have time for question and answer at the end. We're going to write up questions that we don't forget them. You can just write it down to us. Towards the end, we'll bring them out. We can have 5-10 minutes to do question and answers. Okay, good. So we've come to our third and final lecture of today. Thank you so much once again. Yeah, you're always amazing with all the lectures. Okay, so we're going to bring our third speaker, Dr. Omotola Omotosho, who will be talking to us about cancer awareness generally, cancer signs and symptoms, and what we're looking for concerning all types of cancers. So let's welcome Dr. Omotola to the microphone.
Good afternoon, everyone, and thank you for having me here. Lauren, thank you again for the invite. I think we've known each other now for some weeks, months, and well done. Congratulations to you also for putting all this together. Everyone, congratulations for this opportunity which you have taken advantage of. And I would want to say thank you very much, Dr. Asante and Mr. I was able to make some of your lectures. Quite informative, very informative, I would say. Thank you very much. So I will be talking about cancer awareness and cancer risk. I'm a general practitioner, okay, and a little bit of that means we're just next door to you. We live in a community, okay, so quite close to you. I can say you wouldn't be able to differentiate if we meet in the supermarket between ourselves. People like Dr. Sade, they're higher up there. This is probably what they're higher up there. Think about what you can, the advantages you have by visiting your GP or giving a contract with your GP. First, you come to the surgery, you don't need to pay for parking. You always have a parking space. If you want to see Dr. Sade, you think about parking. If you want to see Mrs. Balogun, you think about hospital parking, you pay for that. So, my point there is, don't hesitate to get to your GP if anything is going on different from what you know. The other thing is you can't see Dr. Sade or Mrs. Balogun easily like that. And by the way, to see them, you need to go through your GP. So, wherever you notice that is different from your normal self, don't hesitate to contact your GP before things go out of hand. So talking about cancer risk as well as the awareness about it, we'll go through this outline as highlighted. Okay, so we'll do the introduction and statistics initially, and we will follow all the sequence as highlighted there. Next slide. Yes, so by way of introduction, cancer, we don't really know what causes it, but we've been able to identify things that are the risk factors. So, some things we're going to be viewing there later on, they're not necessarily the causes, but things that have been associated with cancer. So, what do we know about cancer? It's something that occurs in the body when the abnormal cells grow uncontrollably. So, our body is made up of what we call cells. Before we become a full human being, which is what we call an organism, we have different things that make us up. Okay, in our elementary school, we call it the building blocks. So it's like looking at this building, it's not just a single brick making it up. The brick are arranged together to form the walls and partitioning. Then you have the metal parts, you have the plastic parts. So same thing with human being. Now, our cells are being programmed such that they have a sort of balance in it, such that the cells have a lifespan during which they get to a particular time and they go on to die. Now, that's depending on the kind of cell the body we're talking about. But nature has it that we have the balance that we need at that time. So, the cells are supposed to die at 3 months, like red blood cells we do at it. We form a new one, the old one dies. Now, there's a form of balance there. So what happens in cases of cancer is when something that's supposed to degrade or die, it does not die. Or something that's supposed to be formed does not form, but rather starts forming something else. Then we have that abnormality. So in lung cancer, we know that the statistics is 1 in 2 people in the UK. 1 in 2 people will have cancer at one time or the other in their lifetime. Now, having said that, I wouldn't want us to say, okay, that's not work. Then I'm just going to say, no, it doesn't apply that way. Cancer will have 100 people here, 50 people, yes, I want to phone among the 50 people that will not have the cancer. No, it's that at a particular time, taking the general view of it, we can say 1 out of 2 people or half of the people in that will have cancer in their lifetime, not at that particular time, but in their lifetime. So around 375,400 they get diagnosed with cancer in the UK right now. So that tells us how significant the statistics is. For some reason, men are more likely to get cancer than the women. I don't know, maybe for some offenses or something, but for some reason it's been identified that statistically men are more likely to have cancer than women. And the chances of getting cancer increases with age. Now that we cannot experience it amongst children also, but as we mature, that chances occur. Bearing in mind, we all have those building blocks, the cells, right from example of course. Now, you can imagine what's happening with the nature of the cell, growing, injured, eating up, going. So a lot of things happen over years. It's like buying a new car. Okay, so you can't say everything is still fine. You need to go for the annual servicing. At some time, you need a replacement of some things. Similar thing happens in the human body. So with age, it is expected that the chances of developing cancer increase. Next slide, please. The signs and symptoms that we need to watch out for, especially in nurses. And one thing I want to point out there also is, you're like your own, you're the very first doctor for your own self. Because you are the one that knows what's normal for you. And when you notice something that is not normal, the responsibility is you want to check it out with someone that will be able to advise. So, signs and symptoms. Cancer can affect people in different ways. So you need to know what is normal for yourself. Some people, they might not even have any symptoms. And that's the downside of it, because even some have come to us unawares also. Maybe to feel no, like the biggest way that we have an investigation, that the result comes back in a scary way. And that would be like, oh, we weren't even thinking about that. So that does happen at times. Sorry, if you just slide again, please. Previous slide. Okay, thank you. One more. Next. Okay. not normal, seek medical attention. Now, most of these signs and symptoms are most likely caused by something less severe than cancer. But time heals. Now, if it's going beyond that time or healing that is expected, then we should go for medical attention. So there are going to be some of the signs or let's say symptoms we're going to be talking about. It doesn't necessarily mean they are cancer. That's just a note of warning, just so that we don't feel paranoid or too anxious about it. Yeah, right? So going on, those are some of the general ones that could present with cancer from any part of the body. So, night sweats and people almost seem different. So if you end up going to the gym or you're working hard or monitoring your diet, it is expected that the weight might drop. But if you can't explain why, then you need to be concerned. Tiredness more than usual, unexplained bleeding from different parts of the body, gum, the urine, the skin, different parts of the body, unexplained pain. And we talk about lumps and bumps in the body. So you see a swelling which you did not notice before. Check it out. It could be a sign of cancer. Not that it is, but it could be. Now when you notice any changes in the skin, seek medical attention, including the nails. The first change you might notice might be in the nails or in the finger. Anything you're not sure of, check with your GP. Next slide, please. Now, on the Cancer Research website, they have this beautiful picture which just highlights potential symptoms that you could notice that can indicate a cancer of one part of the body. So if you spot anything that is not normal for you, don't ignore it, whether it's listed there or not. I'm not emphasizing the beauty of one Mrs. Balogun mentioned earlier. Know yourself, know what is normal. And when you notice something different from normal, call for medical attention. Okay? Next slide, please. So we're going to be going into the 4 commonest causes or 4 commonest types of cancer in the UK. First one is the breast cancer. It's said to be the most common cancer in the UK. And the percentage, 96% of cases are seen in women over 40. 15% of newly diagnosed cancers in the UK are breast cancer. So it talks about the importance of that amongst the population. And what are the signs and symptoms that we notice? We notice a breast lump, pain, skin changes, or any nipple problem, or any sort of lump in the armpit. So it's not just limited to the breast alone, it extends also to the armpit area. That might be the first place you feel the symptom. And there's even the locations in which patients or individuals didn't have any symptom in the breast at all. It was just in the armpit that the first sign was noticed about breast cancer. Okay, next slide, please. And those are the risk factors. Remember, we said we don't know the causes, but these are the things that increase the chance of an individual developing breast cancer. The genes or the family history, ethnicity. Afro-Caribbean have been known to have the cancer of the breast of body at an earlier age. Our diet, which includes things like alcohol, smoking, overweight, HRT, those are the risk factors that can contribute to it. Now, what does that lead us to? The onus is on us to do self-examination monthly, especially for the ladies. Now, I must say that breast cancer is not just limited to the ladies, it can also occur in men. And that's where things like the genes, the ethnicity, or the family history also comes in. But for ladies, it's expected that you do the breast examination at least once in a month, some days, 3 days thereabout after the menstrual period. And whenever we reach the age of 50 for ladies, we will be invited for the screening test. Okay, let's endeavor to oblige and attend such. Now, these are a picture diagram of how the breast examination can be done. Okay, talking about having the different chambers of medicine, quadrants we call it, of the breast, where you're supposed to be feeling with the top of the fingers. and we have extension into the armpit also. I think we do have a video demonstration of that, which will do more justice to it. So that's just going to give us a description of how we're supposed to be doing the best examination when it is being undertaken by the individual cell. While awaiting that, I'll just briefly describe part of what we're supposed to do. Ideally, there should be two breasts when doing the examination. First is to inspect it. Okay, so preferably it's best done when looking at the mirror, in which case you're able to identify any differences. What we expect is, as close as possible, a great similarity in both. Okay, so I want us to watch this. Just letting the sound up for us to do the following. While we're getting that set, I'll just keep talking. So, inspection. So looking at it to see if there's any changes in the nipple, in the thin skin around the nipple side of the area, and actually looking at the hole. That is there any change or is there any difference between the two? Like I said, we expect it to be as closely similar as possible to each other. Then, to start fitting, you divide it into like four. Divide each one into 4 chambers and fill the upper. Okay, I think we got the ball in now. Okay, can we start it from the beginning?
This makes it easy to notice any changes in the size or feel, which could be a sign of breast cancer. Symptoms to look and feel for when checking your breasts or chest may include a lump or swelling in your breast, chest or armpit, a change in the shape of your breast or either side of your chest, changes in the skin such as redness or dimpling. Dimpling may look like orange peel, and redness may be harder to see on black and brown skin. Changes in the look or shape of your nipple or nipple discharge if you're not pregnant or breastfeeding, and any pain that doesn't go away. To check your breasts or chest, look in the mirror with your arms by your sides and then with them raised to look for any changes. Feel around each breast or side of your chest in a circular motion, all the way up to your collarbone and under each armpit. You should use a bit of pressure when feeling your breast or chest, but do not press so hard it hurts. Feel around and over each nipple. You may find it easier to feel your breasts or chest in the shower or lying down. If you have periods, your breasts may look and feel different from your menstrual cycle. Changes in your breasts and chest can also be caused by other conditions. Anyone can get breast cancer at any age, so it's important to check your breasts or chest regularly. You know your body best, so if you notice a change that's not normal for you, it's important to get it checked by your GP. For more information, click the link to the NHS website.
Okay, thank you very much for that. So that's expected for every lady at least once in a month, and at that episode after the period. And that's it with the breast cancer. The next common one we go for is the cervical cancer. You would have seen in the pictures, the beautiful pictures that Mrs. Balima and Dr. Saki were displaying here. The portion where we call the cervix is at the lower portion, just below the womb area. Now, the cervical cancer is quite common also, 14th most common cancer in females in the UK. And some of the symptoms that can present as an indication of cervical cancer are as listed there. So when you start having unusual vaginal bleeding, so you know what your period is like, either say 3 week, 4 week, or thereabout that. So the moment you find noticing something occurring in between or going irregular, it's an indication for you to call for attention. Bleeding during intercourse, unexplained vaginal discharge, and by that I mean, well, someone has just had a childbirth or things like that, you will have some bit of vaginal discharge for just a few weeks after delivery. But in the absence of such explainable reason, there shouldn't be vaginal discharge. Painful intercourse and pelvic pain. If you notice such, do seek medical attention. And by the way, talking about ladies, okay? So in men, all the things can cause that. But in the ladies, it does of course call for medical attention. A little schematic picture of the womb and the cervix again. So we can see the outline there. The womb is the bigger part of the. As the womb, as mentioned earlier, the cervix is the lower end of the womb there as it goes into the vagina. And as was mentioned by Mrs. Barry, you can see that inside the body. So it's not something you see outside. And that's where the cervix is. So it's not something that you will be able to see. Either the cervix change in the appearance for you to call medical attention. So all those other symptoms mentioned earlier will be part of the case to look out for. The risk factors for cervical cancer are as highlighted. Some form of viral infection, which we call human papillomavirus. The common age when it presents is often about 30 to 44. Sexual intercourse, sexually transmitted infection, and if you find no smoking, and the use of contraceptive pills. Likewise, if someone has had family history of cervical cancer, there's no risk. Either mom, sibling, or anyone, there's no risk that the individual is at an higher risk of developing or having cervical cancer. So, what are we to do as ladies? Whenever we're invited for the cervical smear screening, let's oblige. Usually that is done at your GP surgery. You get an invite which is not from your GP, but the procedure is to be done at your GP surgery. And those are the times when you expect it to be done. For anyone from age 25 to 49 in England and Northern Ireland, you should be having it done every 3 years. And from age 50 up to 64, that should be done every 5 years. Usually the letters are sent about 6 months to your age 25. So if 6 months you don't do the age 25, you don't get it, or even at age 25, then get in touch with your GP who can put that in place for you or signpost you to the National Screening Service where you can just call and they'll send the invite to you. Bearing in mind system error can occur. And that of Wales and Scotland is 5 years, 5 yearly that it is done from age 25 to age 64. So that's one responsibility we have to go for. At an earlier age, around age 12, 13, thereabout, children are given the HPV vaccination in their school. As a parent, we will expect that to occur. So you should anticipate receiving a letter telling you your children are going to be given this. And of course, safe sex. Next slide, please. So that's it with the cervical cancer. Now going into the bowel cancer, part of the symptoms that we can notice in such is changing the bowel habits. So that takes us to that first point again. Know what is normal for you. Now we don't all have the same routine of going for a bowel motion daily or every 2 days. So some people, they go daily, some people every other day, some people could even go 3 days. So you know what is normal for you, such that when there is an increase in the frequency or a reduction, then you'll know that this is not normal and the next thing is to call for medical attention. Bloating symptoms blood in the pool, unexpected weight loss, pain or lump in the abdomen, feeling more tired than usual. All those could be signs of bowel cancer. Now, the risk factors of developing bowel cancer include eating too much of red meat or processed meat. Okay, now studies have shown that up to 13% of the bowel cancers were identified at eating red meat or processed meat as a contributory factor to that. Okay. Now, eating too little of fibers can contribute to up to 30%. So, when we're eating, let's remember our vegetables, the grains, we do call them, vegetables and fruits. That does have an impact on our bowel. Overweight and obesity, that's known to cause up to 13 different types of cancer, bowel cancer being inclusive. Low physical activity, so living a sedentary lifestyle, not moving around, that can also make one prone to bowel cancer. Smoking causes about 7% of the bowel cancers in the UK. Next slide, please. Alcohol, 6% of the bowel cancer are linked to alcohol intake. And of course, like we mentioned earlier, age. So 40% of the bowel cancer in the UK are found to be diagnosed at ages 75 and above. Family history. Yeah, that's another important thing. Apart from knowing what is normal for you so that you can identify when something changes, other thing is know your family history. Okay, so if my mom or dad or sibling had something, it is always a contributory factor to an individual that you are at a higher risk of developing it. Bowel, the preceding slide, please. The previous one. Before this. Before this. Let's go. Oh, is it the system? All right. So. Okay, sorry, we'll just get that back into place.
It's the internet.
Okay. Apologies, I think it's the internet connection causing the interruption. Okay. But whenever you notice any changes in yourself, especially with the bowel, call for medical attention. And as mentioned earlier, many of these symptoms might not be necessarily due to cancer, but what we don't want is to miss it when it is due to cancer. Okay? So the onus is on us to call for medical attention whenever we notice any changes. Okay? So moving from the risk factors, we'll go to the bowel screening, that's 19. Now, bowel screening takes place at specific ages depending on where we are in UK and Northern Ireland. And as highlighted there, the target or the purpose of this is to be able to identify any symptom which we might not be able to see physically. Okay. So, and the screening program takes place every 2 years. So you get sent a kit to get a pool sample, which is now sent back to the office where it came from. And they will do the testing and update your GP. Now, the eligibility for that include you have to be registered at the GP surgery, and the ages are, as highlighted, wherever you are in the UK and Northern Ireland. Okay. Now, that is for everyone, all things being equal. But if there is a family history of bowel cancer, that will change. And that will be at the discretion of the consultant, who will see the risk and probably expedite the time that the individual will need the bowel screening for such occasion. Okay. Now, with the bowel screening, like I said, there's a process of getting a testing kit sent over to the individual the moment they reach age 60. And it's self-explanatory, really. It does have the leaflet in it. in which you will be guided on how to take the stool sample. And all you need to do is just take the stool sample, send it back to the screening office, and they will be able to do the investigation, update the GP record, call back if there is need, or otherwise you just have an automatic recall 2 years later. Let's watch the video for explanation.
To do your bowel cancer screening test, you'll get a kit through the post. It can spot the early signs of bowel cancer and it saves lives. In the kit, there's a small stick which is used to collect a sample of poo. The lab checks for any traces of blood in the poo, which is sometimes a sign of cancer. On the day you do the test, write the date on the tube. Check your letter for full instructions on how to label the tube. To take the sample, you'll need to put a plastic tub and a few layers of toilet paper into the toilet to catch the poo. And then you just do your business. Then, using the stick from the kit, scrape a bit of poo onto the end of the stick, making sure the 2 holes are covered. Put the stick back into the tube and twist it to close. The tube goes into the envelope provided and into the post. Be sure to send it back as soon as possible and you'll get the results back within 2 weeks. If there's any trace of blood detected, it could be a number of things, not just the early signs of bowel cancer. The letter will explain the results and if you need to do anything next. For more information about bowel cancer screening, go to cruk.org/bowel-screening.
Okay, thank you very much for that. I'm sorry I didn't say if anyone was having a meal or drinking something that we're going to talk about that business. But we all know what business means, is it? No question about that. Thank you. Okay, so we go on to the next one, which is the prostate cancer, and that is mainly in the men. Okay, we had to do the ladies first. Okay, that was why we had to do the cervical and the breast cancer. Talking about the prostate, the appearance, I know we've had a lot of anatomy today by Dr. Zage and Mrs. Balogo, so we're all very brilliant in our structures in the body. So this one has the labels on it. So the prostate is not something you can see. It's an internal organ. Okay, so it's located in that place. So just imagine you have a split in the individual. So it's deeply located in the lower abdominal region. And for prostate cancer, the downside at the moment is we don't have a national screening program for it. So if there is any issue about passing urine, we do advise just call for your medical attention with your GP, who will now be able to assess and advise accordingly. The pipe, which you call the urethra, through which the urine flows to. So part of the thing that this can cause is sort of to be part of the first signs in such case, but many a times there is no symptom with that of prostate cancer. But there is a worry that might be that if it is prostate cancer, then it is advancing. Other symptoms are the tiredness, feeling unwell, and unexpected weight loss in the individual. Okay. So, as mentioned earlier, there is no screening program, but there are ways in which the prostate can be assessed, and that includes doing a blood test, okay, what we call the PSA. Well, part of why it's not a national program is it's not so reliable because this can be raised for different reasons. Okay, a pressure on the prostate, if someone having a water infection, recently, someone having an injury in the area, that will make that PSA go up. Of course, we expect it to be elevated in cases of prostate cancer. So you can imagine if all those are going on and you do the PSA, it can come as what we call a false negative or positive in the individual. So it could be so raised in which the individual will be panicking, whereas it's just because of a recent water infection. And it could be negative, being normal, whereas there is a prostate cancer going on. However, it's still advisable by the time we're reaching that age of 50, contact your GP to have this done. Okay. But like I said earlier, it's not yet rolled out as a national screening program. However, if there is a family history of it, you might want to discuss that with your GP, who can advise on when to do it. And if it comes back in being elevated, further investigations will be done. Okay, so going further, in assessing the prostate, your GP can also examine it from the back passage, just to feel the surface. Because if that is smooth, then that is fine. But if it is rough, it could be an indicator that we need to investigate further in case of prostate cancer. Now, 1 in 6 men in the UK will get it at some time in their life. And it's said to be the commonest cancer in men in the UK. Statistically, that's about the figure we have at the moment each year. Okay, next slide, please. Okay. The next one we'll be going to will be that of the lungs. Okay. So lung cancer is another popular one, and those are the 4 common cancers. We're just focusing on those for time reasons. Bearing in mind, cancer can occur anywhere we have a living cell in the body. So lung cancer, part of the symptoms that we expect to be persistent cough. So you hear someone having cough for up to 3 weeks or more than 6 weeks, we need to get checked with the GP. Shortness of breath, coughing, bringing out blood, feeling tired all the time, or having aches and pains in the shoulder or in the chest area. That could be a symptom of lung cancer. So we advise the individual, get in touch with your GP. Next slide, please. Reduced appetite, recurring chest infection in an individual. So the person might have it now, feel better, or having it recurrently, like maybe having another one within a couple of months or within 3 months. It is worth checking with the GP to assess what might be going on. Weight loss, as mentioned earlier, swellings in the fingers, which cannot be explained. Check with the GP. And those are the risk factors. Smoking. Smoking seems to be popular in everywhere when it comes to cancer. So smoking, asbestos exposure, those are the materials used in making some ceiling structures in the past. And when people are exposed to it without adequate protection, it can find its way into the lung and put them at the risk of lung cancer. Dust containing those chemicals can cause that. Coal tar, chronic inflammation, so from infection or irritation in the lungs, that can cause it. Ionizing radiation, that's why at times when we go for an x-ray or something like that, you'll see the staff moving out and also protecting whoever is not supposed to be having the x-ray. It's because of the exposure to those radiation. Those are part of the risk factors that can contribute to it. Now, the lung cancer, it doesn't have a national screening program, but there is a sort of initiative in place that is called the Lung Health Checks, which is a form of a screening program, we'll put it that way. And that was initiated by the NHS in 2019. Not everywhere, they move from one location to the other. And their aim is to actually identify anyone that might be having lung cancer at an earlier age so that they can successfully be treated. Okay? And there are criteria that people need to meet before they can be invited for this screening program. Okay? And that's the targeted lung cancer screening. Next slide. Those are the criteria for the individual within that age range. And they must be registered with the GP because that's actually how the screening service is able to pick them up. they must have had history of smoking. So they are invited, they have a telephone call with either the nurse or the GP, then they measure the risk and then send them for a CT scan of the chest because the X-ray doesn't always speak it. Okay? Now, talking about the risk factor awareness, things we need to live it when it comes to cancer generally. So avoiding smoking, healthy diet, because obesity or overweight can lead to about 13 different types of cancer. Now, mostly we have up to 200 different types of cancer that has been identified so far. Enjoying the sun safely, okay, and that includes whenever we're in the summertime using the sun cream. Now, if we do have the dark skin, that doesn't give a complete protection. We still need the sun cream. Okay, it does offer some form of protection, but still not 100%. And bearing in mind, even all the sun cream, they come in different factors. None of them offers 100%. So, whenever we're going into the sun, good sun protection, either with the cloth or application of sun cream. Cutting down back on alcohol, because it's identified to cause 7 types of cancer. Physical activities, so avoiding a sedentary lifestyle. Vaccination where required. So we get that invite for the children by the school when they send a letter. We don't need to decline it. It's been identified to be safe. Let them have it. And whenever we're invited for a schooling program, at whatever age, let's oblige to attend. Now I must say here, we do have transgender or non-binary, so someone born as a female, say they're changing to male, it is still advisable to fulfill or for them to attend all those criteria at the screening process when invited. Okay. So next slide, please. We can go to 32, please. Yes. Why do we talk about reducing all those risks? It's all because many of them can be prevented. Okay. So when we make healthy changes or healthy choices, it helps to reduce those risks. Remember, we said we don't know what causes it. So, but we know some of the risk factors. Now, if we have some things in our control, which include those risk factors, the onus comes upon us to actually do as much as we can to reduce those risk factors, because by doing that, then we reduce the chances of developing the cancer. Now, some of the risk factors, they're out of our control. Age, for example, even if it is changed on paper, the bones, the cells, they still feel the same age as they were. So the things that are not in our control, then we can let that be. But the things that are in our control, so quitting smoking or avoiding smoking, and it's not just for smokers directly, but also passively. So if one is in an environment where one is being exposed to smokers, that can also put the individual at risk. Okay.
Internet problem.
Okay, sorry, some internet problem. We'll get the link soon. We just go to 32. Hopefully we should be able to accomplish that. So, during the screening, whenever we're invited, that will also help in reducing the risk. The physical activities, that helps to reduce the risk of the individual. Healthy eating, healthy lifestyle. We've identified things like obesity, contributed to about 13 different types of the cancer. So, we keeping fit, healthy lifestyle, that can also help in reducing the risk of cancer. And like I did mention earlier, know the family history. For example, that of the bowel cancer, which doesn't start until like 60 in England. Now, if there is a family history of bowel cancer, the individual might need to be screened earlier before that age. So knowing your family history, knowing what exists in the family. And we talked about alcohol the other time. Now, the thing about alcohol is there is no complete safety level. We can say, all right, recommendation of 2 to 3 units. It used to be 2 to 3 units for ladies, 3 to 4 units per day for men. But now they're saying 2 to 3 units. But the thing is, even at whatever unit, there is still a risk when it comes to alcohol. Now the diet, okay, I'll still keep speaking until we get to we get a favor from that of the internet service. Okay. Now when it comes to the diet, yes, healthy diet, like was mentioned, especially things like red meat intake increases the risk of bowel cancer. It's been identified that dairy products, they do protect against some cancers. Vegetables or fibers, they also help reduce the risk of cancer. Now, there is no specific diet that is known to completely reduce the risk. But all of them, generally, ensuring we have a balanced diet does help with protection or the reduction of the risk. Not strict protection that if you eat this, then the person will not have cancer. But if you eat healthy, it helps to reduce the risk of developing cancer of any part of the body. Okay. And when we get that, we'll just talk a bit about lifestyle medicine and its impact on general life itself. Okay, and I think the first one we'll be talking about there will be the healthy diet, which we'll still see more of it. Now, the healthy diet, apart from it, protecting the bowel, especially against whatever could be toxic onto it, it also helps in the weight control and weight management, bearing in mind that obesity and overweight can contribute to a list of cancers. Next one will be physical activity, which has to do with we being active physically, apart from emotionally or mentally helping in protecting and reducing the risk of cancer. It also helps in different parts of the body, mood-wise, physically, weight control, which, like we highlighted earlier, can lead to a risk factor of cancer. Oh, let's take it back. Okay.
What number? Number what?
Okay.
We have slide 32. Slide 32. Okay, we're still having an issue with connections.
Okay, next slide, please. Okay. Next slide. Okay, let's still move on then. The next one about lifestyle medicine itself is one, reducing or avoiding smoking, like mentioned earlier. The diet, like we mentioned also, and that diet, apart from the food that we have, it includes the alcohol intake. Okay. Another one is avoiding risky or unhealthy behavior, part of which include things like smoking, gambling, all other activities that could impact on the individual health. Because all those, apart from helping to reduce the risk of cancer, they also help the individual as a whole. Don't have to worry. Okay. So we're still not having a good connection with the internet. But in summary, what we need to know is identify what is normal for you, know when things that are abnormal occurs, know your family history, seek medical attention when you notice any changes. When invited for screening, attend. When invited for the vaccination, especially in the teenage year, as parents, let's oblige, because we would have passed at 12, 13 by the time we're parents, so let's oblige allowing the children to have that. Okay, have it back. Trying to see where we are at the moment. Okay, let's go to the next one. Okay, let's keep moving. Okay. Alright, so that was the one about diet and cancer, like mentioned earlier. High fiber, dairy product, they reduce the risk. But when we talk about alcohol, processed food, red meat, they increase the risk. Next one, please. Next slide. Okay. I think I've paraphrased many of them really, in view of the internet now serving us favorably. Okay. So, mainly, those are the things we need to watch out for. When you notice anything different from usual in your body, call for medical attention. When you're invited for the screening, go for it, and together we can actually win cancer. Now, there was a slide about the different myths about cancer that I had there, and that had to do with things like mobile phone, thinking that a mobile phone cause cancer. It's not been identified. Things like burnt toast cause cancer, not identified. Yeah, the toast, no, it doesn't. And that comes to us as Nigerians and Ghanaians. When we talk about either Ghanaian or Nigerian jollof rice, we do know where the bottom of the pot is often quite tasty. It has no risk with that. The things that are being identified are the diet, like we mentioned before, unhealthy exposure to sunlight, drinking, alcohol, smoking. Those are the predisposing factors to cancer. Let's just go to the last slide, the very last slide before thank you. 48. Yes, I always liked this quote. That was one of the things I was exposed to in the medical school. It says, from inability to let well alone, from too much zeal for the name and the content of what is sold, from putting knowledge before wisdom, science before heart, cleverness before common sense, from treating patients as cases, and from making the care of the disease more grievous than the adherence thereof. Good Lord, deliver us. That was by the physician, Sir Robert Hutchinson in Scotland there. Next slide. Thank you, everybody. We welcome any questions.
Thank you so much, Dr. Omotola. That was an amazing one to end the day, isn't it? Yes, thank you so much, my wonderful speakers, wonderful guests today. So we're going to get the children to go to the canteen so they can start having their lunch. So the children, young people, can go to the canteen now and get some food while we have a session for Q&A. So if you have any questions, anything that's bothering you, anything you want to share, we have the experts with us today now for another 10 minutes. So the floor is yours now. Can we have a microphone, please? Here. Thank you. So I'm going to leave. Okay. So I'll hold on to it. And then, so let's, so if you want to ask a question, you can say your name and then make your question.
My name is Aita Kino. I want to ask Dr. I forgot the name. Dr. Solani. You said
Mix.
Okay. Ask the first question now. Take the microphone.
my question is directed to what you said. I'm diabetic type 2, and I constantly, sometimes go to toilet 3-4 times in the night. And sometimes sweating a lot.
Be careful.
So when you're teaching, say, when you are going to toilet more than 2 times, a sign of maybe an important subject, so they need to elaborate a little bit. And Dr. You spoke about a gynecologist. I went through the same process of the hysterectomy due to the fibroid, and you mentioned something to do with in relation to what you were saying. So just to recap and elaborate so that I don't even fear as a woman in your mid-50s with diabetes type 2. Thank you.
So thank you very much.
If you don't think where they come from, is that what you're saying?
Yeah.
Okay. You said 3 to 4 times due to diabetes. Sometimes we have what we call comorbidities, right? And you can't be sure, So we know that diabetes can be a factor. However, because you're having that symptoms of waking up 3-4 times in a day, are you on an insulin or medication?
I'm on medication, metformin twice a day.
Okay.
And then I use the HTR as well for the hormone.
Yes. So sometimes that could be, however, because of your age and the history of, you're telling me that you have hysterectomy in the past as well.
Yeah.
And that is so hysterectomy is a core factor to having what we call pelvic floor dysfunction.
Okay.
So which means any surgery, any pelvic floor surgery, any gynecological surgery can put you at a risk of developing pelvic floor dysfunction as well. So it's just like a circle. All these things is like a circle. And it's not going to harm you to present and say, you know what, I've been to a place today, they said, even though I know I have diabetes, but they said frequency of urine during the night could be this. Can I have something checked? And you can tell them other symptoms that you have. Because I know that hysterectomy puts you at a risk, and you having those symptoms as well is worth checking. Because women of your age, certain of your age, they tend to have a couple of 1 or 2 things going on. Because like I said before, most people don't even have symptoms. And if you do have symptoms, it's always good to present. So we never can tell, but you going to the doctor, they trying to check, it's not going to harm you, rather than it's going to help. So don't be unfair at all. It could be strictly with diabetes, or it could be something else. And like I said, pelvic floor dysfunction is so common. It's just that we don't talk about it. Thank you very much.
Thank you.
Thank you for that question. I think Tolani has said it all, and I think what she's told you is absolutely spot on. I think it's more than likely everything is fine, okay? But the message we're trying to pass on is just get it checked. Go see your GP, let them do a few tests for you, and reassure you that everything is fine. Okay?
Thank you, Dr. Okay, any more questions?
Good afternoon, doctor. Thank you for the wonderful session. I've actually learned more about I've never had about that before, so it's the first time of hearing that. So my question actually goes to Dr. Balogun. Yes, about pelvic floor. And I'm someone that loves pregnancy. Most times we see as young beings and sometimes at night I do read 2 or 3 times. Thanks to Khan, they organized a program on pelvic floor that was some months ago. So that was where I learned how to do the pelvic floor exercise. So sometimes I try to look it and I say it's working. But the only time I remember is maybe when I'm pressed. I'm like, oh, I'm pressed. So I try to do the exercise and I feel it's working. So, but now you said, standing up 2 to 3 times to begin the night. So, is that a sign of pelvic floor weakness? Then another question is, when I had my 2 babies, I had them through cesarean section. So, and I noticed anytime after the surgery, I always have difficulty to urinate and to pass feces. So is that a sign of pelvic floor weakness? Or I don't know. Then the third one is I've seen cases where you see women standing up from their seats after a long time. You see their clothes wet at the back. Is that another sign of that? Thank you.
Thank you very much for that. So I'll try and remember everything you said. So the first question, if you can remind me the first question. Taking tea, right, okay. So your tea, the tea that you take, is it caffeinated tea?
No.
It's decaf tea, okay. And how late is that?
When you feel like, okay. Right, okay. So there's something about tea, whether it's decaf or caffeinated tea. We know especially with caffeinated tea, when you drink caffeinated tea, you need extra 2 glasses of water, to watch that caffeine come to the system. You drinking quite a lot of fluid during the night time, late during the night time, that could be a factor that is like, okay, you need to go to toilets more often. However, if you're having to wake up 3 times or more during the night, just get to check in the hotel. So what we're saying, what we're trying to question is about you being aware of the symptoms and you trying to present as well. Because the truth is we never can check. And all the symptoms, if you look at Dr. Hedy, what he said, and Dr. Motola, you realize that everything is so, you can sync them together. All the symptoms with different diseases. So we need to be just getting them checked and clarify that, okay, actually, you're not having this problem or you're having this problem, okay? Secondly, pelvic floor dysfunction is a very common thing. It's a very, very common thing. But the good thing is, you can tone that muscle if you have laxity. If you have weakness of the muscle, it is tonable. And how can you do that? Is by regularly and being consistent, with your exercise. However, like I said during my presentation, it's not everybody that needs to be doing pelvic floor exercise. Because some people have hypertonic pelvic, which means it could be too tight. Some people will suffer from what we call anismus, because they are being tensed and all that, and everything is just like that. If that happens, we need to teach you how to relax your pelvic rather than asking you to do the exercise. But if you fell into a category whereby your pelvic floor is lax, in terms of laxity or is weak, then it is tonable. But how can you achieve that? If you look at it in this way, when you go to GP, to the gym, you want 6 packs, right? People that want 6 packs, what do? They eat healthy. They go to the gym and they're lifting weights and they're doing everything. But if you go once on a Monday, for example, and then you remember 2 weeks after, I need to hit the gym, trust me, you're not going to get any result. So that is it. So it's just about consistency. If you feel like you're having weakness to the pelvic floor, it's good to speak to your GP as well, because they can have that check, okay? Just minimum checks. They can tell you, you have a pelvic floor dysfunction or not. What's your thought, question? Right. So I said during my section that when you cough or sneeze, jump, rub, laugh too much, if you feel like you leak, no matter how tiny the drop is, it is not normal. So any kind of leakages, whether it's pee or the bowel, it is not normal. It can be a sign of weakness in your pelvic, and it could be structural as well, structural defect. It could be due to organ prolapsing, it could be defecatory issues. There's so many things. It's a complex subject, it's massive. So it's not something that we can talk about, everything today. But my advice is please speak to your GP, somebody like Dr. Omotola. Speak to them, and if they feel like, okay, you need to be referred, definitely I'm sure they'll refer you and we'll get everything sorted. Thank you so much for that. Thank you.
Thank you, Salani. So any more questions? We have time for probably one more. And then, we still have our gorgeous scholar from Cannes in the corner. So somebody was trying to do her screening. Have you finished with your screening? Did you finish? You can go back and finish it now. Yeah, because she's going to go in a bit as well. So if you want to finish, we've got scholar around the side. She's doing health screenings today. So I think she can probably do 1 or 2 more. Yeah. So if you want to get something into your body checked, food, with a little break, she can check everything, blood sugar, all. Yeah, so you can go around to her. Yes, Ida. Anybody, hold on. Anybody has any more questions? Let me take somebody else's question first. Any more questions? No? Okay, then go on then.
In regards to HRT, you said factors and risks in it. Is there any other option to say, like when you start the menopause, you put us on HRT to control the hormonal imbalances? Because it's very like you're sweating. My symptoms were sweating a lot and peeing a lot during the night. But now it's stabilizing. But with the long-term factors, because I know that I'm going to be on that one for as a long-term, and for me to be not in the fear of the unknown, because I lost a sister to pancreatic cancer. So it's within my family history, and hence my sister was diabetic, ended up having pancreatic cancer, and already I'm diabetic, I'm not saying God forbid, but within the family history, like you mentioned, is there anything like besides the HRT, natural remedies that we can take to boost, to avoid this, I don't know why they call it menopause, they should call it women pause. Men know nothing about this thing, but we are the ones who go through all this. So just to recap, and as a gynecologist, as a man gynecologist, so just to emphasize something, please. Thank you, Doctor.
Thank you so much. That's a really important point you raised. I think the issue with HRT is, I remember about 20, 30 years ago, when I did my presentation, I told you this study was called the Energy Plan. About 20, 30 years ago, we used to put everybody on HRT. Once you hit 50, menopause, HRT, life is fantastic, until we now started finding the problem with HRT. And that's when we started going back. So now what we say is that HRT is useful. It's useful for women who need it, and it's useful for a specific length of time. So we're just going to put on HRT and use on HRT forever anymore, because we know that the longer you use it, the risk increases, breast cancer, other cancers. And that risk is specific to different people. So again, this is where Dr. Mentola comes in. You need to have a discussion with your GP. They will consider your risk profile, okay? They will consider whether you still need to be on HRT. Look at how long you've been on for. Look at what risk you're on. And then on the basis of that assessment, they will go to advise you if HRT is still the right thing to do. Okay? So these days, we tend to use HRT for limited periods, okay? And once we achieve the goal we're using HRT for, then we move people on to other things that are less harmful. And there are many other things that you can use that are less harmful. But the important thing is to just have a holistic assessment, okay? And we think we can do that for you, and we'll be able to advise you.
Yes, it's answered.
Okay.
When it's getting more complicated and outside the current, I have looked at what other people for disciples and like protection also. There are other options for people that don't want to go on for long because HRT is getting more. So there are some other medications that have been tried depending on the impact and the severity of the symptom. So if we're dealing with that, we might not want to go down the route of HRT to reduce that risk. But HRT does have a whole lot of protective factors to that.
Thank you so much. Wow. We've come to the end of our session today. But I'm just going to bring a gorgeous lady here, Rosanna. She's a health an enthusiast about healthy living as well. So she's going to say 2 minutes, Rosanna. It's happening to brand the one with disease, Yes.
For those of you who don't know me, my name's Roxana Shah, and I'm in test-based nutrition, and that's what we do. And I have, I'm a part of a big company called Vinci, which is actually on the trading set, so it's not one of these companies. And these products are all vegetarian, and all herbal stuff in there. So we have a balance oil, which helps you with your brain health and all the different healths in your body. And balance oil comes in aqua and it comes in vegetarian, and it helps you with your brain function. And people who have had cancer before, and it does help, but not while you're on the treatment. And if you're on warfarin, you cannot take the oil, but you can take some of the other supplements. They're all health supplements, and you can take them. And this is the new product, which is collagen, which a lot of ladies use. So this is pure, and all the oils are made from olive oils and the very fine fish oils from the Norwegian Sea. And these are all our doctors that are on board.
Oh dear.
This one.
Sorry, yeah, you can go on.
Yeah, it's okay, I'm all right.
Okay.
So basically, we have what we call protocol health, which is these products that you take for your gut health, and you have for your immune system. And we have tablets for anxiety. If anybody has a lot of anxiety, we've got Viva, which helps you relax. So you take 2 in the morning, 2 in the evening. And then we have the shakes, green shakes, if anybody wants to lose weight or look after themselves. But like I said, we have the gut health, which is very important, as the doctors will tell you. It's very important. If your gut health is good, everything is good. Because as we get older, and also it's about your omega-3 and omega-6 balances in your body and your fatty acids. And we do a balance test, which is a blood test we do. And this tells you about your omega-3 and omega-6 levels. As you all know, and the doctors will verify that when we're born, our omega-3 balance is 1 and normal, they're in 1 and 1. As we get older, it gets higher. I'm a diabetic and I have health issues. And since I've been on my products, my diabetes has come down. And I don't take as many tablets. I don't know if doctors will agree. And I have a friend who's had a stroke and he's been on this. He's been on the oil and everything's clear in his medical. The stroke that he's had, everything's cleared, and his diabetes has gone. He's come off all his tablets, and that's obviously wanted by the doctor as well, because the doctors have to do. And that's why, since I've been on this product, my diabetes has come down. It's not as high. When I had my last test, it was 133 HbA1c was so high that my doctor thought I should be in hospital. But I was fine. But now it's come down and it's about 60 something. Amazing. So I'm doing well.
Thanks, Roxana. Okay. Have a chat with her at the end if you want to. Okay, thank you. And then also I want to quickly bring the Chief Executive Officer of Caribbean African Health as well. Fame, that's the microphone to say hello to us. Say hello to everybody. And I saw the Chief Officer also and Charles is listening as well. So just say hello to us and then we can.
Hi, afternoon everyone, and absolutely fantastic presentations, by the way. I was listening on YouTube on my way here. Fantastic. Learned a lot as well. But brilliant session, Laura. Thank you so much for organising that. And I think there's so many messages in that, isn't there? Just about getting involved, getting engaged with screening. We know that we have more disparities in cancers, and we need to get there early. So just brilliant messages. Thank you so much, Laura.
Thanks,
and everyone.
Thank you. And Charles, give us a wave. Alright, so thank you all so much for your time today. And of course, my wonderful guest speakers, you were all amazing. You know me, I'm going to be dragging you back here very soon. Very, very soon. I know you're very busy doctors and consultant nurses here, but I know at some point we'll plan another day to come around, get more people. I really want people. I was hoping this hall would be full, trust me. I was really hoping we'll get there someday. I know probably the next one we can get still with more seats. Okay, so we've come to the end of our session today, and I want to thank everybody for coming. I see all my beautiful ladies in the back, and a few gentlemen as well. Yes, so thank you for coming, and my young ladies as well. Like I said, I want to get the young people to be learning about cancer awareness, like you say, catch them early, can never be too early. So that's why I really want our teenagers to be getting involved as well. So when next time you come with your young ones today, make sure you're bringing your teenagers. Once they're 11 and they're girls or women, once they start their period, they're women already, so they need to learn about all these things. So I want to say a big thank you again, and thank my volunteers, my wonderful volunteers, and then my staff members and charity and everyone, and of course the media team. We can't do it. I know it was a bit funny today, but anyway, we'll get there. Thank you all so much for covering the occasion for us. And everybody online, do you have everybody watching online? Yes, so thank you to everybody that's watching online. I'm going to come to the venue. So it's time for us to go have some food. Feel free to network and have a chat. We're going to go to the canteen now to have some food. And yes, and this brings to the end of our community awareness session. Thank you. We have a post and feedback. So just carry your phone and do us because go and grab some lunch. Don't run away. I'm going to see you in a minute. Yeah, so there's a post and feedback and so we're doing. Please don't be not good. Just carry your phone while you're waiting and we can fill it in. Thank you.
Major.